And welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning and welcome to the Monday Morning Minute. I'm Dr. Todd Shatkin. Today we're going to be doing an upper roundhouse implant bridge using mini implants. And I'm just marking the locations of where I'm going to place the 10 implants. In the anterior, her bone is about 11 millimeters to 12 millimeters in height. Posterior, we're going to use 10 millimeter implants, 5 on each side. And so I'm using 11 and a half, 2.5 by 11.5 implants in the anterior. We've already anesthetized her. We made our locations. Okay, we made 2 holes. We're going to go ahead and place those implants. Touching here. Touching right here. Our first implant's in place. We just did upper and lower roundhouses on her husband before this, so the 2 of them are having all their teeth taken care of today. Okay. That's the first 2. What's that, honey? You're going to get 10 altogether. Next one. And after this one, we'll do the 10s, okay? So we're doing 6 of the 11s. Position here. Now we're going to do 2 5/10s in the posterior. Remember, the 2 5/10 millimeter implants actually have 8 millimeters of threads. The 2 5/10s have 8 millimeters of threads, and the 2 5/11s will have 9 millimeter of threads. So you got to keep that in mind when you're figuring out what implants to use. Open big. Okay, and one more. My light off?
Yes. There you go, son.
Getting all that, John? All right. Got 5 implants in place, and I always still like to tap on them. Make sure they're nice and solid. Now we're going to do the other side.
Yeah.
11. And another 2, 5, 11. Next one. 2, 5, 11. These are the Shatkin F.I.R.S.T INTRA-LOCK mini implants that we've been using now since 2006. Fabulous implant system. The only system out there, still the only one with the Ossean coating. All right. Now we're going to go ahead and do the third one. 2, 5, 11. Open big for me. Open big, open. Don't let her close. And what does the Ossean coating mean? The Ossean coating is the calcium phosphate surface coating that's patented by INTRA-LOCK, now owned by BioHorizon. It's the only mini implant system in the market that has that surface. Now we're going to do the 10 millimeter implants. And we will probably do a Xantex Roundhouse. Open for me. Hold on. Okay. Didn't find the hole there. Turn this way just a little bit. Okay, last one. Her sinus is dipped down in the back, so we really don't have room to put any more in, but 10 should be enough. So we've got our 10 implants in place. Turn this way just a little. And we're still going to do the tapping. All right, very good. Let me see the temporary roundhouse. Here's a lab fabricated temporary roundhouse. And that fits really nice. And we'll put housings on there. She has a lower partial, so we'll put the partial in right now and just check the occlusion. We got to get your bottom teeth cleaned at some point soon. Okay, close gently together. What's that?
I think, yeah, we had a treatment planned,
Yeah, we'll do that.
which
Okay.
is actually scheduled to.
Open. All right, put the housings open for me. Housings on all those implants. So we're going to use O-ring housings for temporary use to attach the temporary roundhouse. And we may do that with the Xantex bridge as well, just because her bone's a little soft in the posterior. That gives us the flexibility to retrieve it and replace it, and we can always add implants in the future if we need to. Got it? Okay, so now we're going to just try that on. That fits really good. That's perfect. Okay, so now, next step, just go ahead and bite together for me. And perfect. Okay, next step is to take the impression, open, take the, I'm using Luxatemp to pick up the housings in this temporary. You can use any type of temp material you choose, Pro Temp or Visalis, whatever you like to use. Go ahead and bite together and hold that nice and tight. And we're just going to fill in a little bit underneath here. Keep biting. Okay, just hold it like that for a couple minutes, okay? Still up all the way on the inside?
I haven't moved.
Okay. You'll cut out that other part of it, the video. Right? You'll cut out the part that... Okay, we're removing the temporary. And that looks good. Now we just need to trim this a little bit. You can go ahead and trim a little bit, okay, and polish it up. All right, so we've successfully placed 10 mini implants on her upper jaw and finishing up her temporary. And that's a wrap. We'll see you next time on the Monday Morning Minute.
Join us for our last advanced course of 2025. We're going to have a great lineup of speakers at this course. It occurs on November 20th, which is a Thursday, the 21st, which is a Friday, and the 22nd, which is a Saturday. It's a 3-day event. And Dr. Gordon Christensen will be lecturing on Friday, the 21st. And then in the afternoon, when Dr. Christensen finishes up, we're going to see some great live surgery from Dr. Shatkin. The previous day, on the 20th, we're going to have Dr. Shatkin lecture. Dr. Tharp will be lecturing with us. And then Saturday is going to be a phenomenal day of education. We're going to be in our new preclinical lab for our hands-on demonstration. Dr. Shatkin and Dr. Tharp will be running that. But right before that starts, Dr. Tharp's going to talk about his 40 years of implantology, some of the things that have gone very well and some of the things that haven't gone so well. He's going to talk about that. We're going to talk a little bit about using your iPhone or your Android to take dental pictures, really nice pictures. And then we're going to talk a little bit about our hands-on and what to expect during the day. It's going to be a real great session. We look forward to having everyone coming out to Buffalo one last time for the year. And you'll get some hands-on experience using real bone in our new preclinical lab. So it's going to be a great day of education. I hope everyone has a wonderful week placing mini and mono implants. And we look forward to seeing everyone in Buffalo on November 20th, the 21st, and the 22nd. Have a great week.